Welcome, families. We're excited to see you all join us. We're going to wait a few minutes to let everyone into the webinar before we get started, but we are so happy to spend this part of our Friday with you guys.
And happy last day of June.
Can't believe it. Flying by. See a lot of people joining us. We're going to get started in a couple of minutes. Just as a reminder, we will record this session. So if you have to duck out, never fear. You'll see the recording pop up on our website so you can come back to reference. We also want to let everyone know here that you can type questions into the Q&A. And we have a team of folks that will answer questions there if we don't answer them live during this webinar.
I think we can get
It is 12:01, and this is typically when we get started. Greetings from the Atlanta campus here at Emory University. I'm Sherry Abrahimi. I'm Director of Conference Services and Housing Administration, and Interim Director of Family and Parent Programs.
And I'm Sherry Obrentz, Associate Dean in Emory College of Arts and Sciences, and we're really happy to be here with you to talk about transition of care.
We have wonderful panels today. This is going to be a really informative and wonderful way for you to spend part of your Friday with us. We'll let our panel introduce themselves, starting with Adrienne.
Oh, we'll let everyone.
We'll go ahead and
yeah, we'll kick off and they'll introduce themselves as we go through. We're covering a lot of information today. This really is the culmination webinar of the last 3 weeks where we've talked individually about immunizations, health insurance, accommodations, and this brings it all together as we're talking about the transition of care. So a lot of great information for you, parents and families, and hopefully some great ideas of conversations you should be having with your students and a few last minute kind of to-do items before you arrive in August. So I'm going to turn it over to Sharon Rabinovitz to get us started.
Wonderful. Thank you, Sherry and Sherry. I'm happy to be here and congratulations for the journey that you're about to embark. And we're here to talk about transition of care. But what is transition of care? It really is that movement between healthcare facilities that you make. And this is a specific transition because it's also layered with a life transition that you are all going through and a developmental milestone in everyone's life. So we wanted to give you, I'm very much of a bullet point checklist. We wanted to kind of start with what are the things you should be thinking about right now. So the first thing is make your last appointment with your provider. Hopefully you've done this already, but if not, it's not too late. And that is to really get some of this information locked down for your student as they navigate forward, but specifically getting their prescriptions updated, having 3 to 6 months available to them at any time is really important. Obviously, they can transfer, especially for some of the larger chains, they can transfer the prescription to Georgia. So I think that is a really important thing that you can talk to your provider about to get those prescriptions ready so they have them down here. There's plenty of times where we get that frantic call, I'm on my last medication pill today and I need it today. So we want to try to keep that stress level down by getting ahead of that. The other thing is educating your student. And I know you've been planting the seeds over time about this, is how to make your appointment, what's managing expectations of how long it takes to get into an appointment, and also insurance, which there is a great webinar we did in June on the 16th with Tammy Kim, our director of insurance. So definitely look at that as a reference of all the different information about insurance, but making sure that your students understand some of the basics about insurance, co-insurance, deductible, and so forth. And it's really also important to educate your student about self-care. Sleep is important. All those other things to keep them healthy is really important. And that conversation that you've already had, hopefully, about if you're struggling and you need help, who do you go to? And so that's one of the things we're going to talk about today too. Like I said, insurance, there's a lot to cover about insurance. We made a whole webinar dedicated to that. So definitely look at that. And then finding a local provider, we definitely would recommend you reaching out to the resources on campus, student health, psychiatry, case management, and CAPS. If your student has been seeing a long-term psychologist or therapist, there are options to connect with long-term care for those in those cases. But it's always good to start with the resources here, and we can help navigate. Adrian Bryan-Smith will be talking about case management. I think one pearl to come out with this is that's always a good place to start if you get lost in the shuffle of there's so many resources, but who do I start with? Case management is always a good place to start. Where do I go? Who do I connect with if my student is struggling or needs help in XYZ way? There's also case managers embedded in student health and psychiatry and in CAPS. So there are case managers dotted around all of our offices to make sure that everyone has the support they need. It is not something we think about, but tuition insurance is something to pause and think about just in case, because we know that if there's a personal history or a family history of mental health issues, that time of life, 18 to 25, is when a lot of those issues bubble up or worsen. So it's important to pause and think about whether tuition insurance is right for you and your family. Next slide, please. So I'm going to transition talking about specifically student health services. So we are all about access to quality care, patient satisfaction. We have student health services, which includes many services, which I'll talk about in a second, and psychiatry within our building, and there's our building. We are a higher education entity. And so not only do we want quality care and provide quality care, but we want it to be an educational experience that they take away from Emory lifelong. We also want to make sure we're supporting and integrating all of our resources to support the well-being of our students. And lastly, you're going to be hearing a lot today from this team of how we support students, and it really is an integrated team-based approach. Our office hours are 8:30 to 5. There's our number, but I want to also reiterate that there is 24/7, 365 access to someone either on call with a medical call center or TimelyCare, which we'll talk about, which is our third-party platform for telehealth. So we'll talk about that in a few minutes.
And Sharon, we didn't talk about this, but maybe one recommendation just from this slide is going ahead and programming the student health service number into your student's phone. It's a great number to have on call so that if something happens, as an emergency, or I'm not sure where to start, that's a great place to call as well.
Thank you for mentioning that. The other thing that's good to program on a website browser for your student is the patient portal. The patient portal, they can access appointments, they can access their labs, their notes, speak with their providers. So the patient portal is another thing to really make sure that they highlight and know is accessible. And you would be surprised at how many people make appointments at 2 o'clock in the morning. Next slide, please. So this is another important point. So most provider visits are free regardless of the student's insurance. That is covered by insurance. It's covered by tuition rather. So the student can come every day if they wanted to, and there's no charge for the visit. The charges and the insurance really take precedence when they're getting labs or vaccines, medications, and that's where we utilize those resources as far as insurance to cover those ancillary services. But speaking to a provider, getting that support is free of charge. And like I said, we have a comprehensive team, full breadth primary care, sexual health, sexual and reproductive health, sports medicine, nutrition, immunizations, allergy, travel medicines, and more. And of course, psychiatry, which you'll hear from Dr. Elliott in a few minutes. Next slide, please. So important deadlines. I am, again, I need my deadlines and my checklists, and anything in red is important. So July 1st, which is actually tomorrow, is the deadline for your immunization compliance requirements. Please upload them as soon as possible onto the patient portal, which I spoke about, and we will verify them as soon as possible. There's probably a 3 to 5 day turnaround. So know that there's some time baked in. The insurance waiver deadline is August 1st. So if you are not going to keep the student health insurance, it's again an opt-out. So you're automatically enrolled in the student health insurance unless you waive it. And that waiver deadline is August 1st. And that can be done through OPIS. Next slide, please. And this is something that we get a lot of questions about. So we wanted to kind of bring it to your attention and answer any questions that you might have. So always in healthcare, it's important to have clear guidance of who's the decision maker in healthcare situations. So it's always important to have that and think about that. It's not required for us at this time. It can be uploaded into the student health portal, and it would be documented internally. It is not communicated to the hospital. So that is one important point to make. The other important point to make is, however, the FERPA document in the student portal is mandatory and very important on a day-to-day basis, because that's where your student can designate who we can speak to and communicate with. So if you have a student who has really bad mono or tonsillitis, you're just worried and you want to make sure that we've covered all our bases, or you wanted to give us information that we need, the only way we can speak with you about the case, the student's case, is that if that FERPA form is filled out, giving us permission to speak with you. So that's another take-home point that I think is really important.
Before we move on to psychiatry, Sharon, there are still questions for parents and families who have students who are not yet 18. So throughout the summer, even maybe the first semester, what is the process? Are there additional forms or other things that need to be printed and submitted differently?
Yes, thank you for addressing that. So there are some forms on our website, and the most important thing is the consent for treatment form for either mental health or for primary care. And that needs to be signed by a parent and uploaded into the portal. So we can access that when the student comes in. It always delays care, especially in more of an urgent situation. It delays care and causes stress for everyone if that's not already uploaded into the portal for the student. So yes, the forms can be found either in the patient portal, but the forms are also on the website under quick links, under forms, and you can print out the consent for treatment, which a parent needs to sign, the student needs to sign and upload into the portal.
Yes, so those do need to be printed, signed, and uploaded.
Yes.
Great. Thank you.
Alrighty, I'm going to hand it over to Dr. Bobby Elliott, the Director of Psychiatry.
Hello, thank you, Sharon. I'm Bobby Elliott. I'm the Director for Psychiatry Services at Student Health Services. Sherry, if you could advance to the next slide. At Student Health, there's kind of two main clinics. There's the primary care clinic, and that was all of what Sharon was just talking about. And then on the first floor in the same 1525 Clifton Road building is psychiatry. And probably the most important piece of information that I can give you today is the appointments number, which is on the slide. Of course, it's also online, 404-727-6145. That's the number to call to have your first appointment, or if you just have any questions about what services we have available or how to set up appointments with psychiatry. That's a great resource. So we do offer both in-person appointments and telehealth appointments. Those have been very popular, the telehealth appointments, really since the pandemic started. And one important piece of information to know about that is that the patient, that is the student, needs to physically be in the state of Georgia at the time of the appointment. That is because of state licensing rules. However, if you kind of slide your eyes over to the right on the slide, there's the TimelyCare information. And so one of the great things Emory has helped to provide to kind of reach students wherever they might be in the United States is TimelyCare. So I'll touch on that briefly, but one thing to know about TimelyCare is that there are psychiatry appointments available for students in all 50 states. So if somebody happens to be in Florida, New York, California, wherever in the United States, there are psychiatrists available through TimelyCare at no cost to the student to have appointments. So what'll happen if you call us and set up an appointment, we'll first set you up in our clinic. If it's going to be more than a week or two until our next available appointment, we may offer the TimelyCare as kind of an overflow option, but it's always an option. It's not something that you need to do. We offer psychiatric evaluation. So those could be like one-time evaluations. If there's some question we're trying to answer, or diagnosis question or something like that. We also offer follow-up appointments, and there's no limit on the number of sessions. There's no charges for those appointments. We want to be able to have the service available to students for as long as they need us. So it's included in your health and wellness fees already. And so we really value accessibility. You don't need a referral to see us. You could have a referral, but you don't need one. You can just refer yourself. It is important that the student themselves call to make that appointment. So it can't be made by a parent or somebody else. It has to be the student who's actually requesting the appointment. So just be aware of that piece of information. These are private and confidential sessions, appointments, they're clinical. And so we're not going to discuss any of the information with anybody outside of our clinic unless the student wants us to do that and signs a release of information to do that. And that's really important because, students may not want the information shared with, say, the academic side of things or others. So it's really up to them. But if they do want us to share information, we can, as long as they sign a release of information. And then also in terms of urgent mental health services, those are mostly going to be through the counseling and psychological services. You're going to hear from Dr. Cynthia Whitehead-LeBeau, who's a psychologist, in a little bit. She's going to talk about some of that, and also through the student intervention services. And Adrian Smith will talk about that as well. In psychiatry, we're mainly operating through an appointment kind of system. So it's not the best system for someone to just walk in if they need something urgently. We do have some flexibility in that respect, but for the most part, it's not really set up as a service for urgent services. So this slide just covers a little bit of information in terms of transition of care. So this would mainly be if the student is already in mental health treatment, particularly with medication, prior to coming to Emory, and they want to transition care to a provider in the Atlanta area, maybe in our office or maybe in some other office. The main thing is coordination, as it says on the left side of the slide. As Dr. Rabinovitz said, to decrease stress, it's not ideal for people to show up on their first day and call us and say, oh, I just took my last day of medication. What do I do? Can you send me a refill? Obviously, we would need to do an evaluation and kind of see what's going on to see if that makes sense before actually providing a refill. And so it's important that the home prescriber provides enough of a supply of medication to last at least for a few weeks, into the time that the student is coming to Emory. Ahead of time, sometimes it's helpful for the home provider to send records. If the student is planning to transfer care and they consent to sending records, we can also facilitate that through our office. And then the last piece I would mention is in terms of ADHD and psychoeducational reports, which is on the right part of the slide. In terms of ADHD, there's a lot of good information on our website. So I would definitely refer you to the website. We do treat ADHD. We do prescribe refills for ADHD medications. However, we only do that if there's another thing such as anxiety or depression that we're also treating at the same time. Really, because we don't have the capacity to treat students who only have ADHD. However, there are several psychiatrists in the community that we've kind of reached out to that accept the student health insurance, and we can help facilitate referrals to those psychiatrists. Students are taking ADHD medications and they need those medications refilled or just, more assessment in terms of ADHD. So I think that's all I have. I look forward to your questions. Dr. Whitehead-LeBeau.
Hey. Yes, I am Dr. Cynthia Whitehead-LeBeau, and I'm Associate Director of Clinical Services at CAPS. Happy to be speaking with you all today, and welcome. So all of our units, not just our units, but every part of campus life, we are dedicated to promoting flourishing. And as you can see from the image, it is multifaceted. And so we all play a role in trying to foster growth in our students. Our entire community understands and owns, and we are champions to focus on well-being from a holistic perspective. And we all strive to create an environment so that students can show up, be authentic, feel safe, to fully be their true selves, to be seen, and to find a sense of belonging. And there are a lot of different ways to do that. So it's not a cookie cutter circumstance. There are a lot of ways that folks can do this. And so our hope is that that we can foster students to be able to have a collective impact in a sense of purpose, not just at Emory, but in the future, their future endeavors as well. So we're hoping that students' time at Emory is where they're learning things that will last a lifetime. Certainly as a therapist, I've been at Emory almost 30 years, and I've worked with so many clients and seen growth and change and development. And one thing I really love about working in a counseling center is I have a chance to work with students when they're on the younger side. Of course, we have graduate students that are older, but to be able to help them to see some things and to create new patterns that hopefully will last a lifetime. And so that's something that's a passion for me that I've been doing for a long time. So next slide, please. Okay, so at the counseling center, we're open from 8:30 to 5 each day, and there's our phone number. And I'll talk a little bit about Talk Now, in another section. But basically, students can walk in, they can call, and I'll be sharing a little more about how to access our services. Next slide, please. Okay, so TimelyCare, as Dr. Elliott indicated, was I guess purchased, if you will, during the pandemic, so that students who were not in Georgia, I, as well as Dr. Elliott, is a licensed professional, am only licensed in Georgia. So this particular service allowed for students when they were remote to have access to counseling services, psychiatry, medical appointments, no matter where they were in the country. So this service we still have. And so students, if you see the information about how to download the app and whatnot, that's just a good thing to have. You don't need to go through CAPS to do that. You can do that on your own. And they offer 12 sessions per year, and that goes from August to August. And of course, medical and psychiatry. And the Talk Now is a service where no matter what time it is, middle of the night, 24/7, students can, once they have downloaded the app, access to be able to talk to a mental health professional if they're having concerns or issues that they want to discuss. Okay, next slide, please. Okay, so in terms of our services at CAPS, I kind of want to piggyback on Dr. Elliott a bit. Our services are free and confidential. We're all licensed professionals, and so therefore, as with psychiatry, everything is confidential, and we won't disclose any information unless the student fills out a release of information form. With regard to, and also to, we offer in-person and telehealth services. With regard to students who are not yet 18, if you're not 18, your parents have privilege, you do not. But at the counseling center, we can meet with students, but in terms of ongoing treatment, if we're going to be seeing them for regular therapy sessions, we do have a form that the parent would have to sign to give us permission. And full transparency on that form, it's worded in such a way that we're asking that if your student is under 18, even though you could call us and say, I want the whole file. I mean, we're sort of asking that for the sake of the work and to really be able to connect with the student and have them feel safe with us, that, even though they're not 18, that parents would respect that privacy, even though they are signing to give students permission to work with us. So we're hopeful. That doesn't happen too often, but we're prepared for if it does, as most of our students are actually over 18. And so the way you access our services, we do something called an initial phone consultation. Student can walk into CAPS, they can call CAPS, or they can schedule themselves online. This is a brief 20-minute phone appointment And in that meeting, you meet with, you talk with a CAPS professional, and it's sort of like assessing what are your needs, what's going on. And then from there, based on our clinical impressions, what we feel is going to be most helpful for students, there are a lot of different things that we might refer to. We might refer to TimelyCare. We might refer students to a group. We might refer them for what we call an initial screening. Depending on the circumstances, might refer them into the community. So that's just a first step to enter our system. Of course, if students walk in on triage, that's another way. If it's like a crisis, that kind of circumstance that, we would meet with students, and that's another way. But for all other cases, that initial phone consult is first. From there, we do if it's deemed that, it's appropriate for you to be seen at CAPS, we do an initial assessment. And then from there, we take it from there. And in terms of, we offer individual couples counseling. In terms of the couples counseling, both members of the couple must be Emory students. And again, we offer brief services. In terms of group therapy, some of the groups we've done in the past, like interpersonal groups of all different kinds, women's group, Grief and Loss. We have had an Albert Emory group. We've had men's groups. We've had international student groups. We've had BIPOC groups. Really just depends on kind of student interest and the ones that we can kind of get going. So those are subject to change every semester. But we send out information so all of our campus life partners are aware. We also have offered psychoeducational workshops on things like stress management, imposter syndrome, factors that impact first generation students, etc. We also offer skills groups. One of the ones that we offer now, it's like a 5-session, and it's called Coping with Difficult Thoughts and Feelings. I like to call it sort of like Life 101, and helping students to understand if they're having feelings, that's human. How do you observe it? How do you soothe yourself and get through those difficult times that may lead you to feel anxious or depressed? I think what's learned in this particular group, it's good for everybody, whether you're a therapist, whether you're a student, whether you're a parent. It's just sort of how do you manage, things that you can do to manage. In terms of crisis support, I've already mentioned Talk Now, which is the service that's available through TimelyCare. We are open from 8:30 to 5. And again, a student can walk in if they're feeling like they're in crisis or need to speak with someone urgently. They can also call and reach out. And during the fall and the spring, we have something that's been in existence for, I directed the helpline when I got here in 1993, but it had been in existence before I even arrived at Emory. But it's a student-run peer-to-peer anonymous helpline that students can call. It's 727-HELP, and I'm sure you'll be getting more information about that during orientation, but that's between 9 and 1. In terms of referrals to community providers, we have something called Thriving Campus. We have a clinical case manager who can help with that. And in terms of outreach and interventions, we do orientation, we do tabling events, we do suicide prevention information. So next slide, please. All right.
Good afternoon, everyone. My name is Adrienne Bryant-Smith. I'm the Director for Student Case Management and Intervention Services. I can't see everybody, but I'm glad to be here. I just want to take a moment to let's take a breath. That's a lot of information that you guys just took in, and you're going to continue to receive a lot of information over the next coming weeks. So I would say don't feel too pressured about committing all of this to memory. Kind of going back to what Sharon was saying in the beginning, a good starting place to access a lot of the services that we're talking about here is student case management and intervention services. I have a team of case managers available to assess your student, coordinate what they need, and then refer to providers either on campus or off campus. You can see that my office is located in the Alumni Memorial University Center, the AMUC, on the first floor. I keep a lot of snacks. I try to create a very warm and welcoming environment because a lot of times when students are coming to our office, they're experiencing some type of distress and just don't know where to start, where to go, and are feeling very overwhelmed. So we pride ourselves on creating an environment where students feel safe and can kind of take a moment to ground themselves before we help them with their next steps. I also oversee our SIS team, which is our Student Intervention Services team. That is a 24/7 crisis response phone line where we have responders from all across campus there to assist students with the things that go bump in the night, right? I may not know how to get to talk now, or I may need to, access student health services in the morning, and I just don't know what to do. We do have a 24/7 line that students are able to access. We also facilitate resources connected to basic needs like housing insecurity, food insecurity, mental health, and medical providers in the community if something happens, helping students get to inpatient treatment should that come up. We understand that things happen as students are on their journey here at Emory, and our job is to help support them through those difficult times and help them get to where they need to go. I think the next slide. I will say this, if you or your student want to get it connected to a case manager, you can actually fill out a student of concern form that is located on our website, and one of our case managers will respond to you, letting you know that you've received your concern, and reach out to your student to schedule an assessment. At that point, the case manager will create a treatment plan or a care plan with your student, which is also non-clinical, by the way, to assess where they need to go next. We typically keep our cases between 30 and 90 days, but should something else happen with your student, they are more than welcome to come back. Here on this slide, I have my Student Intervention Services crisis phone number. If you'd like to program that in your phone, I think that would be helpful. Again, this is not clinical services, but we are here to help you get to a clinical provider should you need one. We are not an alternative to treatment. We are here to just facilitate the handoff. Next slide. I will say this, I'm open for any questions. Our office is pretty multifaceted. We don't really have a cookie cutter approach to student support because we know that each student's needs are unique. So please let me know if you have any additional questions.
And as Adrienne mentioned, there's so much good information in this PowerPoint. We are recording, and this slide deck will be posted along with the recording later this afternoon. We also wanted to mention accessibility services again. We had a really wonderful webinar last week from our colleagues in accessibility services who talked about accommodations. So if you missed that or you need a little bit more information, it's already posted on the website. But as we're talking about transition to care and transition to accommodations, many of the same tips that Dr. Rabinovitz, Dr. Elliott, and Adrienne have all just shared are about initiating early, having conversations early, and not letting the care lapse in any way. So if you have providers at home, if you have services at home, making sure you have a plan for what the transition looks like and the continuation of care looks like in campus. And I don't want to speak for all of our clinical providers, but Sherry and I probably have seen lots of students who come to college and just think, it's cool, I just want to try. I want to try without my safety net when I get here. And we would like to advocate that come to campus with all of the safety net set up, ready to go. And in the best case scenario, you don't use it, but it's not setting up the safety net after there's an emergency. It's being proactive. So I don't know if any of my other clinical colleagues here want to talk about that anymore, but that's something, that we see on the academic side in housing and others, that in this time of transition when students are really trying to be independent, sometimes some of the really great care and services that they've been using, they want to try without. And
yeah, I was going to mention, Sherry, just briefly, particularly in terms of accommodations, it's probably important to know that it's really up to the student in terms of how they might use accommodations. And so there's no harm in kind of having the university kind of review and grant accommodations to a student, if that's appropriate. But then the way they kind of work is they create a letter which the student can then choose to use or not in terms of individual classes. So it can just be something they kind of keep in their pocket, if you will. But if it turns out that they need it, then they would be able to use it once it's in place, if you will. So so I would agree. It kind of makes sense to be proactive. If you've had accommodations in high school, probably thinking about the possibility of accommodations at Emory as well.
Bobby, that is such great advice, and advice I give to family members and parents all the time. So get everything in line now, get all of your, ducks in a row, as we say, make all of these connections, and then it's not scrambling when you need it, right?
This is kind of our final wrap-up slide with all of our amazing experts and colleagues here. I'm happy to read it, but really no reason to miss out on necessary medical or mental health care. Emory really is a community of care with such amazing resources. And it's a big network. So I do think, this Dr. Rabinovitz started with this, Adrian said it again. Sometimes it's overwhelming of where do we start? And especially if there's a challenge or an issue that comes up and it feels like an emergency, where do we start? So starting with case management with Brian Smith's team, or sending messages through the patient portal are great places to start. Again, all of these slides will be posted with the phone numbers. So having your students going ahead and just saving phone numbers in their phones is a great place to start as well. Before we tee up what's coming up next, Cynthia, Bobby, Sharon, Adrian, anything else that you all want to add before we sign off?
Yeah, I just want to echo what you were saying about a place to start. Sometimes, particularly in mental health, people get a little confused. Do I need a psychiatrist? Do I need a therapist? Where's the right place to go? The case management could be a good option, but frankly, it's okay to call either of us to begin with. And on the phone, each area is able to kind of talk through with the student, for a few minutes, what might make sense. Does it make sense to start with maybe some counseling or talk therapy? Are you mainly interested in medication, which is what the psychiatry side kind of specializes in? So you don't have to know on the front end. And I'm sure we would all urge you to just start somewhere. If you have a question and you're, needing some help, main thing is just reach out and we'll help you get to where you need to go.
Yes, absolutely. And just so you know, we work very collaboratively, of course, with consent forms, but any place that you start, we'll do our very best to help to make sure students get what they need so that they can matriculate successfully.
I want to also add, for parents, if you are concerned about your student, maybe your student is they don't recognize that they may be struggling, but you see that they are. My team will reach out to your student. If you submit a student of concern form or you give our office a call because you're noticing something that's different about your student, you're concerned, and you just want to make sure that somebody reaches out to them and gives them, maybe put some eyes on them, that's another place where my office is able to support students. And then maybe get them to Bobby or to Cynthia's team or to Sharon's team based on, like, hey, how are you doing? One of my things that I'm really big on with my staff is be kind, say hi. It's a good starting place. It may not be a catastrophe. It may just feel like I just don't fit in or I'm feeling sad. I don't necessarily feel like I want to go to CAPS, but just having a soft place to say I'm not feeling well is also helpful.
And Adrian, that is a wonderful wrap-up statement. Actually, I really do appreciate that. For the website on this slide actually is a great place to also reference. It's a transition of care slide or website, I should say. It's on the student health website under new students, and it's a drop down and it's transition of care. So a lot of the information that we've covered is on that, including like what to put in a first aid kit and what people should send with their students as they go off to school. So I think that's a really good bookmark as well.
Okay, there are a few more questions in the chat, so I know our experts will look through those and make sure that those get answered before we sign off. Sherry and I are taking July 7th off. We hope that everybody has a great week next week. Oops, sorry, one last slide. And then in July, July 14th, we'll be joined by our academic advisors talking about advising and registration. Your students, by the way, have done an amazing job of signing up with their advisors. I think over 1,000 have already done that for the weeks in July and August. And then July 21st, we'll be talking about housing, dining, and residence life. So we know that's top of mind for your students. They want good night's sleep, they want to be well fed, and they want to have great programming with peers. So those are our next two webinars after our break, our midsummer break. And again, these slides and others will all be posted on our Family Friday webpage, so you can refer back to the slides and click on all the links as well. We're going to stop share. We're going to allow our final questions to be answered in the Q&A, but we wish everybody a great week, and we will see you on July 14th. Thanks so much. Cynthia, there might be one more question in the Q&A for you.
Yes. This was a great